For this week's edition of Presidential Perspectives, I have two guest speakers. We have Dr. Lilian Odera, who's the director of SU's Counseling Center, and we have Victoria Lentz, who is the director of SU's Student Health Services. They're going to provide some important information on how those student service centers are responding to student needs generated by COVID-19. Lilian and Vicki, thanks so much for joining me this week. Lilian, let me start with the Counseling Center and mental health resources. Students are under enormous pressure, even during normal times, and that's obviously increased during the changes related to COVID-19. How are you all maintaining support for students through all of this?
Thank you for inviting us to this week's edition of your Presidential Perspective. So, you're right, our students are facing significant challenges as they deal with the impact of COVID-19 on their well-being as well as other stresses related to the college experience. Now, since we started teleworking, we've continued to provide services through telehealth. What this means is that students call or they email us to schedule an appointment, and therapeutic services are thereafter provided by phone or via Zoom by our clinical staff who are actually well-trained in using telehealth. So we've expanded also our online services, and this includes a list of various self-help apps on our website, as well as other resources such as handouts. Some of these are specific to how we're dealing with COVID-19, and others are related to diversity, cultural sensitivity, connecting with campus providers, as well as crisis resources. So we've been offering, this is really good, support groups via Zoom. So these groups have been geared towards students of color and include Sister Circle, which is for women of color, and Brothers Keeper, which is for men of color, in collaboration with Multicultural Student Services. So both of these groups are offered on Thursday evenings, and they've actually been well received by our students of color who've stepped into these spaces to actually process their experiences. Students can email us for that information if they need to participate.
That sounds great. Can you talk a little bit about how you'll be expanding that support when students come back in the fall?
Absolutely. So during the fall semester, we will continue to provide services to our students during normal business hours. Now, we anticipate a possible increase in demand for services, and as such, we plan to hire part-time clinicians to help with the surge. But in the event that students experience mental health emergencies in the evening or on weekends, they can access information on crisis resources by visiting our website. So as we reopen, we will comply with recommended health and safety guidelines. As such, we will provide services primarily through telehealth. Our staff will be physically at the center on rotation, so we'll have a skeleton crew, but we will not provide face-to-face services. I'd like to point out that in the fall, we will be shifting to a model of brief therapy in order to serve as many students as we possibly can. Exceptions to the face-to-face services is going to be students who are in crisis. However, we do not encourage students to just walk into the center as they have previously done. Instead, we ask that students, staff, or faculty call the center prior to coming in or walking students over. And that will give an opportunity to do like a phone consultation and a triage. And we are working with Disability Resource Center as well as our Student Affairs Case Manager to ensure that the students can access the services they need, and they're referred to the appropriate offices. But in the event that they want to come into the center, we'd like to provide a safe way for them to complete paperwork, interact with them without jeopardizing their health of that or that of our clinicians. We will require that everybody wears a mask and observe social distancing as they come to the center. We will not be offering group therapy, unfortunately, but the support groups will continue. So in addition to the ones that I've mentioned, we will offer mindfulness and meditation groups. We will be offering crossing borders for international students as well. And finally, just want to point out that we have a training that I think everybody should take. We have this amazing online-based training called Cognito. And this training has a student version as well as a staff and faculty version. Only takes 30 minutes to complete. It's useful in tooling students, faculty, and staff with basic skills on how to help students in distress and make appropriate referrals. You can go to our website to log on to the training. And we'll also have virtual workshops, which is really going to be exciting for outreach. Some will be pre-recorded, some will be live, but it will allow students to interact. Some topics will include, say, managing stress during the pandemic, coping with taking classes online, cultural sensitivity, among other topics. So that's just in a nutshell some of the things we'll be offering in the fall.
Great. Thank you, Lilian. That all sounds really, really great.
Thank you.
Vicki, I know that you all are busy dealing with various student health matters during a regular semester. What does the transition to COVID response look like in the Student Health Center?
Yes, thank you, Dr. Wight, for including me on this week's Presidential Perspectives. We will be continuing our regular operations for students in the Health Center. We will be having face-to-face visits. Just like Lilian described, we would be doing some triage and calling students beforehand. We're going to continue to provide allergy injections for students who are already receiving treatment for allergy desensitization, men's health, women's health services such as annual exams, pap smears, and contraceptives, physical examinations for internships, immunizations, as well as the evaluations of students that are ill. We will be adding the ability to test for COVID-19, in addition to the usual testing for diseases such as strep, mono, and influenza.
That's great. So our students sound like they'll be taken very, very good care of. Can you talk a little bit about how things will be different because of COVID?
Right. So yes, things will be a little bit different in that we will be trying to do some triage over the phone. We will continue to provide telehealth visits for a student that might not need to come into the health center. We'll be doing a lot more testing for students that have respiratory symptoms, as you can imagine. And we're in the process of acquiring an on-call service for evenings and weekends. The university will also be providing additional resources for our faculty and staff for COVID-related concerns.
Great. Thank you very much. Is there anything else that either of you would like to add? Lilian?
Just to add on to that, we are in the process of searching for an assistant director, and this has been ongoing, so we're hoping to really wrap up this process pretty soon. We anticipate that an increase in the staffing of the counseling center is going to be really useful and enable us to provide services to more of our students.
That's great. Good luck in the search.
Thank you.
And Vicki?
Yes, I'd like to add that I'm a member of the university health team, and this task force consists of our medical director, Dr. Michael Murphy, who is also an emergency room physician in the local hospital, PRMC, faculty members from nursing and the biology departments, Dr. Kelly Fiala, who's the Dean of the College of Health and Human Services, as well as many others who are helping us with the task of making sure that all of our policies and procedures that we take into account the health and safety of the entire campus as we return to campus in the fall.
Thank you both so much for all of your hard work as we continue to plan for the return to campus. If anyone out there has questions, please email them to us or visit our coronavirus website. We'll see you all again next week. Bye-bye.